With me is Dr. Mangesh Tiswaskar. Sir is the General Secretary of National Association of Physicians of India body, and sir is currently practicing at Asian Heart Hospital. Sir, welcome to RSSDI TV studio, sir.
Thank you, Rishi.
So recently there has been lot of controversy regarding fixed dose combinations, whether they should be used or not. The government has a different stand. So from a medical practitioners like you who sees diabetes patients day in and day out, what is your take on this? Is fixed dose combinations required in today's treatment for diabetes patients, sir?
Yeah, that's a good question, Rishi. Actually, the fixed dose combination or the fixed dose therapies are the need of the hour today. Now, we must understand that, mainly combination therapies have the established benefit. And in fact, most of the guidelines, including the RSSDI guidelines, have clearly established that early combination therapy helps in many ways in achieving the target goals in the diabetic population. But unfortunately, what happens is this, that diabetes is a disease which also has got a lot of associated comorbid diseases. Like almost 80% people have comorbid existent obesity, 75% people are hypertensives, almost similar number of people have dyslipidemia, around 50% people they have some kind of an atherosclerotic cardiovascular disease. So looking at all these scenarios, multiple drugs written for different comorbidities associated with diabetes adds to a lot of pill burden on the patient, and then the compliance become a challenge. So looking at all these things, fixed dose combination therapies not only will simplify the therapies for the patient, will also reduce down the pill burden, but has got a good achievement as far as the cost cutting is concerned. And of course, the repeated clinic visits are avoided, the in-hospital visits are avoided, and most of the times the patient's compliance is much better than in combination to the loose drug therapies.
You brought out a very, very important and relevant point about compliance. I was reading a very important quotation where it says, drugs do not work in patients who do not take them. And I was also going through the data which suggests as a country we are really doing very poor in terms of compliance. Our patients do not take the medications as prescribed by the clinicians. So fixed dose combinations, do they play really an important role in improving the adherence or compliance of the patients to the regimen, sir?
Absolutely, Rishi. In fact, let's understand the fact that India is also one of the lower middle income countries. Now, if you really look at the GDP or the annual per capita income of India, this year published data, in US dollars it is around 1973. So that comes to roughly around 1.5 lakh rupees per annum. So that comes to around 12,000 or 15,000 rupees per month. And in those rupees, a person who is earning around that much has to not only take care of his family, but also take care of his parents, his children's education, apart from somebody who is also additionally sick. And now on the top of it, he has got diabetes or associated comorbid conditions, which costs haywire. So sometimes, the cost is the biggest caveat that really puts the people on not sticking or not adhering to the therapy. Why people run away from the therapy? If you really look into that factor very seriously, you will find out that the cost is the biggest caveat there. So fixed dose combinations not only will improve the adherence by cutting down the cost of the therapy, will cause fewer side effects, so the compliance will go up, the pill burden will go down, so the compliance will go up. And the most important thing is that fixed dose combination eases out the advocacy to the therapy. A specialist writing down a prescription, it becomes much easier for the specialist or the treating doctor to explain the need for the therapy to the patient who is genuinely confused about what are the timings, when should he take it, how many times he should be taking. 10, 12, 15 tablets written down on the prescription papers becomes a hell of a lot. And it's not only 3 or 4 days or a month's time. The patient has to take this for his lifetime. So that really matters. And that's how FDCs are really, really important.
Is there any word of caution? Are all FDCs rational, or physicians should be sensitive towards what FDCs they are prescribing for their patient population?
Excellent question, Rishi. Now, WHO and even DCGI, that is Drug Controller General of India, has given clear guidelines as far as what are the things that has to be followed when you are probably introducing some fixed dose combination or a fixed drug combination in the market. The drug is called as rational, where most of the times the combination has got an almost identical plasma half life. The pharmacokinetics and the pharmacodynamics of the drugs which have been used, whether they are 2 drug combinations, 3 drug combinations, or sometimes even 4 drug combinations, they should not be far different. Thirdly, they should have mostly the complementary mechanism or synergistic action to each other. They should not produce a lot of side effects. So all these things taken care, the rational fixed dose combinations are always advisable. Now remember that a lot of times the dose combinations are just disallowed because there is no adequate published Indian evidence. So I think that is little hard on the combination therapy, but otherwise the rational therapy has to follow at least these 3 or 4 points which are very, very important.
I think you again brought a very, very important point is how the regulators should look at the combination products available in market. And I think the first and foremost thing to look at is this product useful and required for the patients?
Correct.
And if that is standing true, then they should encourage more and more industries, pharma industries, to generate more data in Indian patients where these products can be found useful, so that our patients which are really in need of these drugs are made available of all these drugs.
Yeah, it's absolutely correct point, Rishi. And the most important thing is, unfortunately, we must understand that the fixed drug combinations or the fixed dose combination therapies, India is the leader in the world. India is the highest marketing of the fixed dose combinations. And if you really do the analysis, a very good paper published from Calcutta has shown that almost 90% of the patients are on with some kind of combination or other. What is the highest used combination that has been there in the general practice today? They are nutraceuticals. There are huge amount of nutraceutical combinations which are sold. Now there the question of rationality comes. But as far as diabetes management is concerned, the patients, they need this kind of combination therapies for multiple reasons that we already have discussed about this. And it is imperative for even the drug controller authorities to take little different stand when they are analyzing the drugs as far as the diabetes market or the associated comorbid condition markets are concerned. Hypertension combination therapies have been well established and they have proved excellent benefits. Diabetes fixed dose combinations are relatively new combinations. They'll require a little more experience, a good amount of data publications, the work publications, especially from the Indian subcontinent, is also needed to support and to enhance the confidence of the drug controller authorities for that.
I think that's a very, very relevant point, and the DCGI and the regulators should look at it very differently. And sir, your last message as a General Secretary of National API to all the large number of physicians who are going to see these videos going forward, should they be hesitant in prescribing FDCs, or if it is a rational FDCs, it helps their patients, should they be liberal in providing the benefits of these drugs to their patients, sir?
Yeah, my last message or my most important message to all of them, those who are viewing me on the RSSDI TV, is this: that you need to understand, first decide whether this FDC is a rational FDC or not. You ask yourself whether I am writing down the right combination of the therapy in the right doses for the right patient, for the right at the right time, in the right dosages, and for the right type of the disease, and I am using the right kind of combination. Now, if everything is ticked right there, then you should not hesitate to prescribe the fixed dose combinations to your patients. But be vigilant. Do not use the irrationally combined combinations. Of course, now I must appreciate the efforts of DCGI and the Drug Control Authority, which has they have screened almost 6,200 combinations in last year or two, and they have almost put a stop on these kind of drug productions. Last month only, almost 340 or more than 340 combinations have been banned, and those are all our combinations which were supposed to be rational combinations were stopped from the being available in the pharmaceutical market.
I think the message is loud and clear that we should give the benefits of rational fixed dose combinations to the patients who really need them, but with a word of caution that we should avoid irrational fixed dose combinations. and we should be aware about that these drugs can also harm our patients if they are not used in right dose for the right patient selection. So thank you, sir. Thanks a lot for joining us and sharing your views with us today. Thank you, sir.
Thank you, Dr. Rishi, and thank you RSSDI TV for this time that I have.